New approach to care for IBD patients. Approximately 1.4 million people in the United States are affected by inflammatory bowel disease, or IBD, a group of chronic diseases of the colon and small intestine, generally falling into the category of ulcerative colitis and Crohn's disease. The illnesses tend to be diagnosed in the childhood or young adulthood and are characterized by periods of remission, followed by flare-ups of symptoms that can include abdominal pain and cramping, diarrhea, rectal bleeding, vomiting, and weight loss. On the outside, you wouldn't know that someone has IBD, says Daniel Holmes, MD, PhD, head of UCLA's Center for Inflammatory Bowel Diseases. But on the inside, it's very destructive. A significant number of patients require frequent toilet visits and have problems with pain. Careers and relationships can be affected. The drugs that are available come with side effects and are ineffective in about 20% of patients who end up needing experimental therapy or surgery. Dr. Holmes believes the traditional approach to assisting patients with IBD has left much to be desired, and so the center is implementing a new approach to chronic disease management, playing off the concepts of intelligence quotient, IQ, and emotional intelligence quotient, EQ. The center is tracking each patient's value quotient, a measure that incorporates the annual burden of the patient's disease, including factors such as disease activity, complications, medication side effects, and hospitalizations, quality of life, and work productivity. Each year, an individual patient's VQ will be analyzed by the center's professional staff to determine factors that influence the score and to devise a plan for the year ahead. It is our mission to annually improve each individual's VQ, Dr. Holmes said. The center's approach to controlling patients' disease is two-pronged. The first involves the development of new treatments. Patients who don't improve with standard medications can participate in the state-of-the-art IBD research through a clinical trials program and a stem cell treatment program. Dr. Holmes has been a leader in both autologous hematopoietic stem cell transplantation, using patients' own stem cells drawn from blood, and mesenchymal cell therapy, using cells with capability of differentiating into a variety of cell types as a strategy for controlling inflammation. The other part of the approach centers around the active role patients play in their care. An online education program empowers patients by teaching them about the disease, treatments, home care, and their individual care. The center is also developing home care devices, including biochips for clinical testing. To ensure close monitoring of their diseases, patients are invited to periodically transmit results of self-administered tests, as well as information on their symptoms, quality of life, and work productivity. Dr. Holmes believes the center's approach can serve as a model for other chronic diseases. David Ziering, MD, director of the UCLA Pediatric IBD Center, part of the Center for Inflammatory Bowel Diseases, says the value-based approach is also beneficial for children with IBD. They will enjoy a seamless transition from adolescence to adult care, will be able to participate in groundbreaking clinical trials of new drugs, and for those in whom conventional therapies have failed, will be given the opportunity to participate in new stem cell therapy regimens, Dr. Ziering said. Like Dr. Holmes, I strive to provide holistic care to my patients and their families, including not only maintaining disease remission, but also optimizing quality of life and school performance.